decisions. Danny Mortimer is Chief Executive of NHS Employers, who are the negotiators for NHS England. Thank you for being with us, Danny.
Good evening.
Your reaction to today, what feedback are you getting from NHS bosses and staff?
It's a really positive step forward, Sarah. The commitment from the Chancellor back in the autumn, which is confirmed today, to fully fund this lifting of the pay cap in the NHS is a significant investment in the NHS after many years of pay restraint. And as the Secretary of State emphasised, it both helps us recognise the really hard work that our colleagues are doing all the time, but also make sure that the NHS is as competitive an employer as possible in the job market in years to come.
What are the strings that are attached to this, Danny, that some people have been talking about today? Because while many people have welcomed it, and I've spoken to them, and I'm not detracting from that, there are others that have said there are issues around getting rid of incremental pay, for example, so everything that you're paid every year, that it goes up annually depending on your long service, etc. The GMB have raised that as one of the issues.
What we've done is reduce the number of increments that are paid to staff, but in doing that, we've actually raised the starting salary right across our workforce, so that encourages people to develop their career with us and encourages people to choose to work for the NHS in the longer term. And we believe that it's in the interests of our current workforce to be able to attract people to come and work with us in the longer term.
I understand. Is there an element of robbing Peter to pay Paul there?
No. What we've worked really hard with our trade union colleagues to do, and our trade union colleagues were really clear that we had to do, was make sure that existing staff also benefited in terms of their pay. So there's a very clear 3% pay award to people at the very top of those incremental scales this year. That's really important to us and really important to our trade unions. And the things that our unions have committed to work with us on in the longer term, which ensure that the taxpayer gets some return on that investment, are things that will help us better manage and better deploy our people. And there's some work we've committed to do together over this next year. OK. We're
frequently told that there is no magic money tree. So people are asking the question today, where is this £4 billion plus coming from? Can you help us with that?
There's clearly a question you may want to put to the Chancellor. He made the commitment. He made the commitment in September to fund the pay award, and the investment that the government are making of the £4 billion over the next 3 years is hugely welcomed by the NHS. It's something that as employers we wanted to see happen, and obviously it's something that our trade union colleagues wanted to see as well.
Danny, what about other public sector workers? I was talking to the head of Unison on health, the health lead for Unison on this. We've seen the police have their pay cap lifted, but what about teachers now? What about other areas of the public sector? Do you think that there are going to be movements on this? I know you're in the NHS, but do you think there might be movement on that during the year?
I'm not really in a position to comment. As you said, my role is within the NHS. I think we were very clear that the particular problems and challenges we were facing needed that level of investment. It's for other sectors and other colleagues perhaps to speak on behalf of what's needed elsewhere in the public sector.
Yeah, but I mean, I guess they would all say the same thing, teachers, etc. I mean, it's been a long time coming, a very, very long time coming. And for everybody I've spoken to today that has said, yes, they're pleased it has come, they've said it in no way makes up for what they've endured over the last 7 years. So you would expect, wouldn't you, to see other public sector workers want this now? It would be only a natural reaction, I would have thought.
I can understand that other parts of the public sector will look at what's been achieved in the NHS in this last 6 months. As I've said, there's a particular set of circumstances facing our workforce and facing our services, and my responsibility on behalf of employers is to ensure that there is that investment in our workforce, which is the largest workforce in the country, the largest workforce in Europe.
Mm-hmm. And just finally, I mean, people have been saying on the text today, Danny, 6% of nothing is nothing. When you look at the rate of inflation and how that's predicted to go up by the OBR, and when you look at the wages, the way they're predicted to go up, actually 6.5% isn't that great. What would you say to that?
It's a significant increase on where we found ourselves with a public sector pay cap. There is a front loading of that pay award for our staff, our longest serving staff, so they get a 3% pay award in 2018-19, significantly higher than the 1% they've received in previous years. And it also means that actually we're going to be investing in our ability to attract and to recruit and to retain colleagues to work alongside them in the longer term. And that's something they also wanted, and obviously we wanted as employers as well.
For you, that must be the biggest single issue, really, is the retainment and the recruitment of staff.
Yes, it's both. It's about making sure that there's a real recognition of the work that colleagues who are already with us have done over this last 7 to 10 years as the NHS has had to play its part in responding to the financial crisis. But it's also about making sure that in the longer term, the NHS can attract people to careers with us, and your pay is a really significant part of that.
Okay, Danny, it's very good to speak to you, and thank you for being so candid with us on the programme. That's Danny Mortimer, who's Chief Executive of NHS Employers. They are the negotiators for NHS England.